Well, good afternoon, everybody. Thank you for joining today's briefing on COVID-19 in North Carolina. As of today, North Carolina has 15,346 lab-confirmed cases, 475 people in the hospital, and sadly, 577 deaths. Our thoughts are with everyone suffering from this disease, as well as the families of those who've died. North Carolina has been in phase 1 of our restrictions since Friday. Our state has seen more stores and businesses open as long as they meet rules for cleaning and screening employees. I think more people got out this past weekend, but most North Carolinians kept their distance with some exceptions. The virus is likely to be with us for a while. Regardless of what phase of easing restrictions that we're in, we'll continue to look out for ourselves and each other. And in each phase, we need to remember the importance of the 3 W's. Wear a face covering, wash your hands, wait 6 feet apart from other people. Face coverings are important to prevent spread of the virus to other people in case you have it. And these 3 W's will become even more important as we hopefully move through the phases and more people are out and about, particularly when we're indoors. Now, I want to talk today about how we're expanding testing in North Carolina. As we laid out last month, more testing is a critical part of our ability to ease restrictions and still keep people protected. Testing goes hand in hand with tracing. When someone comes up positive, our enhanced tracing workforce will find known contacts of that person so people can be tested. And if they have COVID-19, then they should isolate. If they don't, they still need to look out for any symptoms that they might have. Successful tracing builds on itself and obviously requires more and more tests to be performed. To enter phase 1 as we did last week, we doubled our testing to between 5,000 and 7,000 tests a day, and we've been maintaining that. But we have to keep pushing for more. We need it to be easy and safe to get tested. We have many retail partners, including Walgreens, Walmart, and Harris Teeter, that are opening up testing sites for the public. Because these sites are federally funded, it doesn't cost the person to get tested there. More testing at hospital systems and doctors' offices is coming online every day. In order to help North Carolinians know where to get tested, the Department of Health and Human Services will begin posting a list of testing locations on the COVID website later this week. This list will change from day to day as certain pop-up sites open and close or move locations, but it'll help people who need a test to find a site. Another essential part of beating this virus is giving healthcare workers and first responders the personal protective equipment, or PPE, that they need. More PPE is also important in our ability to do more testing, as lab techs and nurses need PPE to collect the sample from people being tested. We've been fighting for more PPE, and our manufacturing task force is identifying North Carolina businesses that can help us. Several local manufacturers have shifted their production lines to make this important equipment. Now, our state has a rich history of being a leader in manufacturing and in innovation, and I'm proud that businesses in our state are leading the way to make this personal protective equipment right here at home. I want to take a moment to recognize them. Saab Barracuda in Lillington usually produces camouflage netting for the military, and Apple Rock, headquartered in Greensboro, specializes in trade show displays. Now they're both making isolation gowns. This is a critical piece of medical equipment that has been in short supply. We also have 3 firms, including ASI Signage of Holly Springs, Galero of Pittsburgh, and Brightview Technologies of Durham. They're now all producing face shields. We've already received several shipments from some of these companies, with more expected in the coming weeks. Thank you to the men and women working at these North Carolina companies and the many others who are finding ways to pitch in, donate equipment, or find another way for their workers to help in this fight. And this is exactly what I mean when I say North Carolina will get through this pandemic by working together. I look forward to more innovation, creativity, and team spirit that has always defined our state. With me today, our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, and Emergency Management Director, Mike Sprayberry. Lee Williamson and Monica McGee are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. I'll first recognize Dr. Cohen. Dr. Cohen?
Thank you, Governor. May is Mental Health Awareness Month, and it's an important reminder that we need to be thinking about whole person health, not just physical health, as we continue to confront this pandemic. We've all done a great job protecting our families and neighbors and slowing the spread of COVID-19, but in taking those important steps, we've had to change the way we live significantly in ways that were just hard to imagine even just a few months ago. We've had to stay physically apart from one another, stop many of the activities that may have brought us joy. Some of us are newly out of work, and others have lost family members or friends to this virus. Not to mention that the pandemic itself can prompt fear and depression and anxiety. One way to navigate this challenging time is to find new, or in some cases old, ways to connect with other people. Call or use video chats to connect with your friends and loved ones. Get outside. Exercise if you can. In phase 1, we're seeing more parks open, which is a great opportunity to enjoy a hike or a bike ride. And although, remember, if you're going to be around other people, make sure to wear a face covering. For those that may need help managing their mental health, please contact your mental health provider or an expert. If you don't have one, start by reaching out to your primary care doctor as a first step. There are additional resources on the North Carolina Department of Health and Human Services website at covid19.ncdhhs.gov, including some resources for our Medicaid beneficiaries and those without health insurance. The National Child Traumatic Stress Network also offers advice on how to communicate with kids of all ages about COVID-19, what to watch for in reactions from our kids, how to offer them help, and tips on approaching periods of social distancing. We also have important helplines like Hope for NC, which you can dial at 1-855-587-3463. It connects North Carolinians to additional mental health and resilience support that help them cope and build resilience during this time of crisis. It's now available to everyone in North Carolina's 100 counties, 24 hours a day, 7 days a week, with a live person to speak throughout this crisis. Thanks to all 7 of our state's mental health managed care organizations, our LME MCOs, and the Real Crisis Intervention Incorporated in Greenville for their partnership on that initiative. Importantly, if you know someone who is experiencing severe distress, help is always available by contacting the National Suicide Prevention Hotline at 1-800-273-8255. Please take care of yourself and be kind to those around you. And remember, staying home is still the best way to continue to slow the spread of the virus and protect our families and neighbors. And if you do go out, remember your 3 W's: wear, wait, and wash. I'll now turn it over to Director of Emergency Management, Mike Sprayberry.
Mike?
Thank you, Governor, and thank you for your leadership. Good afternoon. Today is day 64 of the State Emergency Operations Center's COVID-19 response. We received the news today from FEMA about support for nonprofits across the state that are assisting with hunger and homelessness during COVID-19. Grants totaling $9.3 million will be coming from FEMA's emergency food and shelter program to a variety of nonprofits all over the state. This is a combination of the annual funding allocation from the federal program along with supplemental funds from the CARES Act. That's great news. The funds can support programs offering meals, groceries, and food boxes, shelters, and rent or utility payments. As we continue working to obtain personal protective equipment for the COVID-19 response, teams delivered to 42 counties and 4 healthcare preparedness coalitions yesterday. Shipments included N95 masks, surgical masks, gloves, face shields, goggles, soap, and hand sanitizer. We did receive a small shipment of 2,000 isolation gowns from FEMA and quickly turned those around to fill requests. Sourcing and procurement continue to be a major priority for the state emergency response team. The North Carolina National Guard has more than 930 men and women supporting the COVID-19 response. They've helped deliver 116,000 school lunches in counties like Bladen, Buncombe, Jackson, Madison, Orange, Robeson, and Wake counties. And in their support for food banks, more than 90,000 meals were delivered just yesterday. Other soldiers conducted cybersecurity training for 25 local governments on how to protect their computing infrastructure in the COVID-19 environment. Very important work. We thank these soldiers and airmen for their service to the state during this critical time. Remember to wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. And as always, don't forget to look out for your family, friends, and neighbors. Give them a call. They'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, Governor.
Thank you, Mike and Mandy. And then we'll take media questions. And if you can identify yourself and the media organization, we would appreciate it. And we can take the first question.
Our first question will be from Kenny Beck with WXII.
Governor, good afternoon. Thank you for taking my question. At this point, we're at a place where over the last week or so, the number of tests average per day is right around 6,000. And over about the last 2 weeks, the percentage of positive tests has been at or below 10% every single day. Does a scenario exist, in your opinion, where the state of North Carolina could enter phase 2 early, prior to what looks like right now would be May 22nd, originally announced as the earliest possible date 2 weeks after phase 1? Is there any scenario where we could enter phase 2 ahead of time if things continue to trend in a positive direction?
Thanks for the question. We need to look at all of our indicators and benchmarks over a 14-day period. And we've talked about the fact that none of these indicators by themselves can give us the signal about when we need to move into phase 2, but taking all of them together and looking at where we are over a 14-day period is what we need to be doing to get a true read on what's happening. So I don't think that it can happen any earlier because we need that whole period of time to determine how we're doing. And we are pleased at North Carolina's numbers. I think the people of North Carolina deserve a lot of credit for that. But understand that we are now just into phase 1. We're only, 4 days into phase 1. So we have to make sure that people continue to stay at home as much as possible, continue this 3 W's of wearing, waiting, and washing, and doing those things to protect each other. Thanks. Next question, please.
Bill McGinty, WCNC.
Hey there, Governor. Bill McGinty from WCNC Charlotte here. Appreciate you taking my question. My question has to do with unemployment. You know, my email as a consumer reporter over here is absolutely full of frustrated people. They can't get into the system. When they do get in online or on the phone, they get kicked out or they're on hold for hours. So What technology are you all using? Will upgrades be coming to this system? And what do you want to say to some of these people who are just at their wits' end right now?
First, we know that families need help right now, and every single claim that is filed is important because it represents a family in trouble. And I think everybody over there working knows that. I am pushing employment security to go faster. This is a nationwide problem because you're talking about a system in North Carolina that was handling 12,000 claims, has over 1 million claims now. But what they have done is this. We have now about 500,000 people, about 500,000 people are now receiving unemployment benefits. And we have about 361,000 people who haven't received benefits yet. And they know at that department that they need to do more and that they need to move faster. And I am pushing them to move faster. Things they're doing, they are continuing to increase the number of people who are answering calls. And as you can imagine, there's a lot of training that has to go on for someone to be able to answer a call, but they're putting more and more people on it. There is now a chat function on the website, and they're able to answer people's questions regarding the chat function. But they are working hard to get the rest of those 361,000 people the benefits that they have filed for, and we have people continually filing. Now, there are over 1 million claims, but some people have to file twice because under the law, they have to be denied one kind of unemployment insurance before they can be granted another kind of unemployment insurance. And that's why you see over 1 million claims that have been filed. But actually, that represents 861,000 people. About 500,000 of those are now receiving claims. They know they need to do more and to work harder, and they've opened their hours into the evening and onto the weekend to be able to take phone calls, and they're being pushed and they're working hard to try to make sure that they respond to these, and it's something that we have to do as quickly as possible. Thanks for that question. Next question, please.
Michael Hyland, CBS 17.
Hi, Governor. This is Michael Hyland from CBS 17. We're going to be hosting a town hall later this evening with several members of the state's congressional delegation. I wanted to ask you at this point, what do you believe are the most critical needs that the state has from the federal government? Thank you.
Thanks for that. We've had 3 bills that have been passed by the federal government. We're grateful for those. They have helped us in our COVID response, in education, in testing and tracing, in health care, and we need to do more of all of those things. But we also know that state governments and local governments are responsible for health care, for first-line responders, for law enforcement, and many of these local governments and state governments across the country are going to be in the hole because of the significant hit that this virus has caused to our economy. And we're pushing our members of Congress to pass legislation that does help states and local governments deal with their significant budget shortfalls. If that's not dealt with, then state government and local governments are going to have to make significant cuts in core services like law enforcement, like education, like transportation. I don't think that people want that, and I think that many members of Congress believe that they need to step up. I know that I've mentioned this, and other governors have mentioned this on almost every call that we have with the White House. And Michael, maybe you can tell the congressional delegation tonight this is something that we really need. Thanks. Next question, please.
Richard Craver, Winston-Salem Journal.
Yes, this is Richard Craver with the Winston-Salem Journal. Governor and Secretary Cohen, I have a couple questions, one maybe for each of you. First question is, we had a increase in Forsyth County over the last day of about 50 cases, and they're trying to do the contract tracing to figure out where those 50 came from. But just trying to get a sense if y'all have any preliminary idea of relaxing since Friday, if there's been any kind of significant increase in cases. And then the second question is, Governor, you've been having some pushback in the last week or so since you relaxed with phase one to accelerate to phase two, and I was wanting to see if you have any reaction to that political pressure that you're getting from the legislature and from other groups.
Thank you, Richard. As the answer to the question, second question you have is, we are going to rely on the science, the data, and the facts that we have set out in order to tell us when we go into phase two. We know we need to boost the economy, and it's one of the reasons why we set up these phases. But you can't boost the economy until people have confidence in their safety. We want to make sure that people, when they do go out and visit these businesses, that they are safe and secure, and that they know the numbers are right, and that they rely on us to make those decisions. We get an input from businesses and from other elected leaders about how we should shape these phases, and we appreciate that input. But the science and the data are what's going to drive us, and the health experts and their opinions is what's going to drive us as to when we make these decisions. And I'll let Dr. Cohen answer if she knows what's going on with Winston-Salem's issue.
Hi, Richard. Thanks for the question. So in terms of looking at our overall statewide numbers, they've been largely stable. Even our day-over-day new cases have been relatively stable. And we noticed today we actually had one of our, a day that was on the lower side for North Carolina in terms of a during-the-week day-over-day number. I think we had a little over 300 new cases today. As far as what's going on in Forsyth, I'm happy to reach out to the local health department there and make sure that they have the resources there to trace the 50 new contacts, because you're exactly right. We want to make sure that anyone that was newly positive, that we trace all of their contacts, that any contacts get right in for a test, whether or not they're having symptoms, and then, as the governor mentioned earlier in his remarks, to repeat that cycle. So if anyone is positive, trace them again, get more people into testing, and if you are sick and found to be positive COVID-19, to get folks into isolation for 14 days. I think these are the actions, coupled with these slowing the spread actions like the 3 W's, the wearing the face covering, the washing your hands, and waiting 6 feet apart. These are the tools that are going to allow us to stay stable in this phase one and allow us to move into phase two. It is a collective effort across this whole state, and if we can act together, that's what's going to allow us to make it through these next couple weeks, looking at stabilized numbers and keep looking at those metrics and trends, and then be able to move forward. So I'll make sure to reach out to Forsyth and make sure they have what they need to be able to respond to those new cases. Thank you.
Thanks. Next question, please.
Tony Sedeku, WSOC.
Good afternoon. This is Tony Sadiku with WSOC in Charlotte. Thank you for taking my question. My question is for Dr. Cohen. So some health experts are suggesting that staying at home for several weeks could lead to weaker immune system because of more stress, loneliness, things like that. First of all, I wanted to get your thoughts on that, Dr. Cohen, and do you believe that people might be more susceptible to COVID now that people are slowly starting to go out again?
Well, thanks for that question. And as I shared in my earlier remarks, it is really important to think about someone's overall health. That's their physical and their mental health. Now, we don't see any evidence that staying at home weakens your immune system in any way. But we know your mental health is a big part of you being overall healthy. As we ease through these restrictions and move forward, we want to take advantage of going outside and getting a walk and making sure that folks are taking advantage of the mental health resources that we have across our state to be well. And remember, with COVID-19, we know it's folks with chronic diseases that are not well controlled that really put you at risk for COVID-19 of getting more severe illness. So if you have diabetes, if you have high blood pressure, make sure you're reaching out to your doctor or other clinician right now. Don't put off any of your preventative visits. Make sure you're staying healthy. But staying home does not weaken your immune system in and of itself. What we want you to do is make sure that you get the preventative care that you need, that you're getting your chronic diseases under control with medicine, but you're also taking care of your mental health and getting outside, taking a walk, connecting with your loved ones, or reaching out to mental health professionals to get the help that you need. Thanks for that.
One good thing about entering into phase one is that I think people and the medical profession are taking more steps to care about people's other physical ailments rather than just COVID-19 cases. It's really important for people to get treatment for their chronic diseases. It's important for people to get their preventive health care. I think we have the personal protective equipment in place now where doctors can begin seeing people, dentists can begin seeing people, and you get that kind of preventive medical treatment that you need to stay healthy all the way around. And that's something that we want to encourage during this time. Thanks a bunch. Next question, please.
Jonathan Alexander, News and Observer.
Hi, Governor Cooper. This is Jonathan Alexander with the News and Observer. Have you or anyone else in the administration or cabinet been asked by anyone connected with nursing homes or their ownership, or with meat packing plants or their ownership, not to report case numbers or testing numbers from those facilities?
I'm not aware of that. I know that the department is posting the names of nursing homes that have had outbreaks, and one of the things that the Department of Health and Human Services is doing is providing help to anyone that is having problems in a place of employment or long-term care, because we know that these congregate settings are important to deal with the spread immediately because we see it significantly there. But I'll let Dr. Cohen respond to that as well.
Thank you. I think you got it exactly right, Governor. We at the department and our Division of Public Health, as well as the local health department, want to be sure that we're working with anyone on how they can slow the spread of the virus, whether that's in some of the places that we do regulate, like a nursing home, and we work very closely with them given our regulatory role, or a meat processing plant that's regulated by agriculture, but we know we want to help make sure that we're protecting workers as well as slowing the spread of the virus. So we are encouraging folks to get in touch with us so that we can help them with implementing some of these public health measures that help not just their workers and to keep their businesses running, but also help our communities. So that's what we're encouraging folks to do.
Thank you. Next question, please.
Ken Smith, WRAL.
Governor Cooper, thanks for taking my call. This is a question about testing. DHHS changed its testing guidelines on April 20th to open it up to many more people. Why wasn't that change publicly announced at that time? And your website was just updated within the past 24 hours with the latest guidance. Records show that testing didn't go over 5,000 until almost 2 weeks after that testing opened up. Was there a reason that information wasn't distributed widely at that time, and did we miss an opportunity to test more people starting more than 3 weeks ago?
One of the reasons that the testing was more restrictive earlier in the process is that nobody in the country really had enough tests nor enough personal protective equipment to administer those tests. So the criteria was more restrictive on who could get tests. As we've moved forward and gained more ability to test, more capacity to test, we've gotten more personal protective equipment, and realizing that we want to try to begin reigniting the economy and setting up phases to open more and more businesses, that we need to be doing a lot more testing. So now that we've ramped up getting more personal protective equipment and testing capacity, we want to do more and have loosened those guidelines significantly. And I'll let Dr. Cohen address how that gets out to the public.
Sure. Thank you. You're exactly right, Governor, is that we've been working as this virus has evolved, so has the guidance. And every time we change that guidance, we are sure to blast that out very far and wide to all of the clinicians across our state, posted on our website. I've brought it up multiple times at these kinds of press availabilities. And we want to make sure folks know, if particularly right now, if you need a test, we want you to get that test. That means someone who may have symptoms of COVID-19, a fever, a cough, change in taste or smell, call your primary care doctor. And if you don't have one, call your local health department or a federally qualified health center. They can help direct you to one of the testing sites. As the governor mentioned, we're hoping to have a list for you up on our website so you'll be able to access that more easily. We also, as we were talking about the tracing effort, we know that we want anyone who's been exposed to COVID-19 to also get a test. So we're working on making sure all of that can happen so that as we move through these phases and ease restrictions, that can be an important tool to continue to slow the spread of the virus. Thank you.
Thanks. Next question, please.
Gary Robertson, Associated Press.
Hi, Governor. It's Gary Robertson with Governor, I want to ask you about church services and your Phase 1 order. I know that you had sent, that Lee Lilly had sent to some legislators some information about clarifying what your order means. And I think there's still a lot of frustration among lawmakers, but also church leaders about being unable to hold indoor services more frequently, or it not being just a rare exception. And I just wanted to get your sense of why you believe this is the right path to go to basically prohibit indoor services, given that there are some exceptions.
Yeah, thank you, Gary. I miss in-person church services very much myself. This Sunday, I listened to my church service online, and it's something that we've been having to do over the last few weeks in order to protect each other, in order to care about your neighbor, because we know that inside it is much more likely that you're going to transmit this virus, particularly when you're sitting or standing in one place for a long period of time. And this is across the board. And some people are trying to compare this with retail. There's a big difference. With retail, people are moving around, and you don't have as much a chance to spread the virus, a significantly greater chance, when people are sitting or standing indoors and close together. We are aware of First Amendment rights and want to protect those, and it is one of the reasons why permission has been given for outside services of more than 10 people if there is appropriate social distancing. What we're hoping is that ministers and church leaders will put the health of their congregations at the head of their thinking here, and consideration of each other, realizing that it is still dangerous to hold indoor services when people, more than 10 people are there and those people are closer together. And we want to make sure that the people across this state are protected. I'll let Dr. Cohen also to add to that.
I think you did a great job, Governor, in describing the fact that we know that this is challenging, but we tried in Phase 1 to focus on activities that were lower risk of spreading the virus. And if we look at the things that are the lowest risk, it are things that are outdoors and walking around. The things that are the highest risk are things that are indoors and sitting down. And the reasons are several. One, when you're indoors, you don't have the same air circulation. You have more surfaces that you touch, doorknobs, pews, etc. And also when you're sitting down, it is that contact, it is more than 10 minutes within 6 feet. That is when the virus is most transmitted. So if you think about that as the highest risk and the lowest risk being outside and walking around, we're trying to start as we do this reopening with the activities that are the lower risk. Let's get used to our 3 W's as we do those lower risk activities, and then we'll step through this. Once we are getting used to the wearing, washing, waiting parts of the 3 W's, then we'll do the higher risk activities. But I will say, I hope everyone thinks about their own personal risk and risk to their family. We know that folks who are over 65 and have chronic diseases are more at risk for getting severe illness from COVID-19. So even as we ease up restrictions, I would encourage folks to think about their own personal risk here and their family's risk. Maybe it's not you who are over 65, but someone in your household. So think about that and making your own judgments even as we go and ease restrictions as we move through this. But we want to make sure that folks are as safe as possible. We know this virus will be with us, again, until we have a vaccine. So this is a matter of how do we get used to living with this virus being amongst us.
Thank you. Next question, please.
Our final question today will be from Will Michaels, WUNC.
Hi, Governor. Will Michaels at WUNC. I just had another question regarding some of the criticism that you've been getting, specifically a letter that was sent by the 6 Republicans in the Council of State today, calling for a special meeting of the Council of State and saying, quote, "We need clarity as to why you aren't allowing specific industries to open as our neighboring states have done." Then they will go on to list things like restaurants, salons, and church services. Can I get your reaction to that and ask whether you plan to, as they are asking, convene a special session?
Pandemics cannot be partisan. I've been on the phone with the White House every week. I've signed a unanimous pandemic budget. We're going to rely on the science and the facts to tell us when we need to reopen. I know that people are hurting because of this virus, and I know that our economy is hurting because of this virus. But the health of our people and the health of our economy go hand in hand. At our last Council of State meeting last week, we offered to have a briefing and a meeting on the COVID crisis and told them that we would set it up, and we look forward to doing that. Thank you all for joining us today, and we'll be on again later on this week, and probably Dr. Cohen will be on tomorrow. So thank you, and stay safe out there.